OK, bonjour et merci de vous être rejoints à nous aujourd'hui. Today we will hear from Canada's Chief Public Health Officer, Dr. Theresa Tam, from the Deputy Chief Public Health Officer, Dr. Howard Njoo, from the Minister of Public Services and Procurement, Anita Anand, by video link from our Minister of Innovation, Science and Industry, Navdeep Bains, et bien sûr du Président du Conseil du Trésor, Jean-Yves. Dr. Tam, please.
Good afternoon. Bonjour à toutes et à tous. I will start with the latest numbers on COVID-19 in Canada. There are now 92,157 confirmed cases, including 7,344 deaths, and 50,070 cases, or 54%, have now recovered. Labs across Canada have tested over 1,721,000 people for COVID-19 to date, with about 5% of these testing positive overall. Over the past week, we have been testing an average of close to 29,000 people daily. As hard as the last months have been on all of us, these times have brought additional challenges for some people more than others, including people with disabilities. For some people with disabilities, older age or underlying medical conditions put them at greater risk of serious complications related to COVID-19. Add to this the additional challenges that most face when accessing information, social services, transportation, and healthcare, at a time when there has been an overall reduction in service availability over the last several months. This week, we mark National Accessibility Week. This is a time to promote accessibility and inclusion, and to celebrate the many contributions of Canadians with disabilities. At the same time, we also recognize the efforts of individuals, communities, and workplaces who are taking action to remove barriers and ensure that people with disabilities have an equal chance to participate in all aspects of society. There is much we can learn and gain from greater inclusion of the disability community. It is thanks to their ongoing efforts to create greater accessibility of services and spaces that we all now benefit from accommodations, like having groceries delivered to our homes and working or learning remotely. In Canada's response to COVID-19, we have been working hard to ensure that the needs of people with disabilities are taken into account. This includes engaging national disability organizations, as well as other experts and stakeholders. We have also produced guidance on disability considerations to enable healthcare providers to adapt their approaches and support people with disabilities in accessing services. Today, I would especially like to thank all the sign language interpreters who have been with us every step of the way. Through their work, we are able to convey important information to Canada's deaf community. Thank you. Merci.
Thank you, Dr. Tam. OK, maintenant, je donne la parole à Dr. Howard Njoo. Dr. Njoo, s'il vous plaît.
Merci. Bonjour. Je vais commencer par les plus récents chiffres sur la COVID-19 au Canada. On dénombre actuellement 92 157 cas confirmés, dont 7 344 décès et 50 070 personnes rétablies, soit 54% des cas. À ce jour, les laboratoires du Canada ont analysé les tests de dépistage de plus de 1 721 000 personnes et environ 5% des tests effectués se sont avérés positifs. Au cours de la dernière semaine, nous avons testé en moyenne près de 29 000 personnes par jour. Ces derniers mois ont été difficiles pour nous tous, mais la pandémie a posé des défis supplémentaires pour certaines personnes, notamment les personnes handicapées. Pour certaines personnes handicapées, le fait d'être âgé ou d'avoir des problèmes de santé sous-jacents les fait courir de plus grands risques de complications graves liées à la COVID-19. Il est également plus difficile pour la plupart d'entre elles d'obtenir des renseignements des services sociaux, des soins de santé et des services de transport, d'autant plus qu'il y a eu une réduction générale des services ces derniers mois. Cette semaine, nous célébrons la Semaine nationale de l'accessibilité. C'est l'occasion de promouvoir l'accessibilité et l'inclusion et de souligner les nombreuses contributions des Canadiens handicapés. Nous en profitons aussi pour souligner les efforts déployés par des individus, des communautés et des milieux de travail qui prennent des mesures pour éliminer les obstacles et faire en sorte que les personnes handicapées aient des chances égales de participer à tous les aspects de la société. Nous avons beaucoup à apprendre et à gagner d'une plus grande inclusion de la communauté des personnes handicapées. C'est grâce à leurs efforts continus pour améliorer l'accessibilité des services et des espaces qu'aujourd'hui nous bénéficions tous d'adaptations nous permettant, par exemple, de faire livrer l'épicerie chez nous et de travailler ou d'apprendre à distance. Dans le cadre de l'intervention du Canada à la COVID-19, nous nous efforçons de tenir compte des besoins des personnes handicapées. Entre autres, nous consultons les organismes nationaux de personnes handicapées ainsi que d'autres spécialistes et intervenants. Nous avons également produit une guide sur les considérations liées aux personnes handicapées pour que les fournisseurs de soins de santé puissent adapter leurs approches et aider les personnes handicapées à obtenir des services. Aujourd'hui, je tiens à remercier spécialement tous les interprètes en langue des signes qui sont à nos côtés à toutes les étapes. Grâce à leur travail, nous pouvons transmettre des renseignements importants aux personnes sourdes du Canada. Merci.
Merci, Dr. Njoo. And now we will hear from our Minister of Public Services and Procurement, Anita Anand. Anita, please.
Thank you, Christia. Good afternoon. While this has been a particularly difficult week, I will begin by thanking Canadians across the country, especially our frontline healthcare workers who have risen to the challenge, continually placing the interests of our communities above all else. Their unwavering commitment is literally saving lives, and as a result, communities are emerging from strict restrictions. Toutefois, il est important de se rappeler que le Canada n'est pas encore complètement au bout de ses peines. Nous devons être prêts à répondre à une nouvelle hausse et également à une deuxième vague éventuelle. Moving to discuss supply chains. As I have said from the beginning, our approach is twofold: to buy aggressively and to diversify our supply chains. As a result of our government's aggressive procurement strategy, we are now receiving millions of items of protective equipment every week, with deliveries set to continue for the months to come. Moving forward, our focus on diversifying supply chains, particularly in terms of domestic production, allows us to better adapt to external market volatility. In terms of procuring equipment and supplies, our plan remains to meet short-term and anticipated long-term needs as the pandemic evolves. This is why we have placed large orders in bulk, and we continue to make additional procurements to meet Canada's immediate needs and to prepare for the future. C'est grâce à cette approche mixte que nous observons une plus grande régularité et une plus grande stabilité dans nos chaînes d'approvisionnement, et ce malgré la demande mondiale croissante. For example, we've received 500,000 N95 masks from 3M in each of the last 2 months, and we await delivery of more. These deliveries are in addition to the large quantities of N95 masks that 3M is providing directly to the provinces and territories on a regular basis. In terms of planning ahead, while researchers around the world are working quickly to develop a vaccine, our government is already preparing. I am pleased to announce that we have signed a contract with Becton Dickinson Canada for 37 million syringes in this regard. We are also continuing to work to procure other supplies needed for eventual mass vaccinations on a systemic level. We are making sure that when a viable vaccine is discovered, Canada is ready for its administration. Moving to international shipments. over the course of the last few months, Canada has brought goods back home from international destinations. China, Ireland, and Malaysia are some of the countries that we are continuing to procure from. These shipments are now arriving by different means of transportation. Early this morning, for example, the 51st plane chartered by our government to bring PPE home from Shanghai is now en route to Canada. These shipments are in addition to the commercial flights on which Canada frequently secures space for PPE cargo. Aussi cette semaine, le premier navire à transporter de désinfectants pour les mains doit accoster au port de Vancouver. 4 autres navires sont déjà en mer et transportent eux aussi plusieurs millions de litres de désinfectants supplémentaires. Now for a PPE update on individual items. From the beginning of this pandemic, we have maintained one driving priority: to keep Canadians, especially frontline healthcare workers, safe and healthy. Our efforts at home and abroad are paying off. Gloves. In terms of aggregate PPE supplies from all sources, over the past 10 days, we more than doubled the number of gloves received to nearly 40 million pairs. Gowns. We also doubled the number of gowns received to just over 3 million, with deliveries coming from Canadian companies such as Yoga Jeans, based in Saint-Laurent, Quebec. Surgical masks. I am also pleased to report that we have now surpassed the 100 million mark of surgical masks received, including large deliveries from PriMed, headquartered in Edmonton, Alberta. Face shields. In addition, we have received nearly 3 million more face shields over the past week. More than half of the nearly 10 million face shields in aggregate received to date were made right here at home in Canada, including from companies such as the Canadian Shield, Jacobs & Thompson from Toronto, and the Windsor Mold Group. I will take a moment now to highlight the incredible story of the Canadian Shield, based in the Waterloo region. Before the pandemic hit, the Canadian Shield's parent company, Inksmith, was producing 3D printers, laser cutters, and high-tech instruction materials for schools. When asked if the company could use its technology to produce much-needed face shields, it met the challenge head-on. The Canadian Shield expanded from just 10 employees to more than 200, working around the clock to meet the high demand for its product. So far, the Canadian Shield has provided the federal government with more than 1.2 million face shields, with more on the way. This is an example of the several innovative Canadian companies that are helping Canadians fight COVID-19 while also sustaining and even creating local jobs, allowing Canadians to get back to work. Toutes ces compagnies livrent maintenant la marchandise, et pas seulement à nous au niveau fédéral. Les provinces et les territoires, de même que les établissements de soins de santé, s'approvisionnent directement auprès de certains de ces fournisseurs ou d'autres sources. À l'échelle gouvernementale et en collaboration avec les provinces et les territoires, nous explorons différents moyens de contribuer à soutenir l'accès à l'équipement pour les acheteurs et les vendeurs à l'intérieur du marché canadien. Alors que la pandémie évolue, les Canadiennes et les Canadiens peuvent être certains que le gouvernement demeure déterminé à assurer que l'équipement de protection individuelle et les autres fournitures continuent d'être livrés aux provinces et aux territoires, afin que les travailleuses et les travailleurs de première ligne du domaine de la santé aient l'équipement dont ils ont besoin pour assurer la sécurité des Canadiennes et des Canadiens. I also want to thank the employees of Canadian companies who have stepped up during this very challenging time to make essential supplies. The work that you and your businesses are doing to manufacture supplies right here in Canada is quite literally saving lives. As demand goes up, Canada is keeping up. Thank you so much. Merci beaucoup.
Okay, thank you very much, Anita. And now we will hear from our Minister of Innovation, Science and Industry, Navdeep Bains. Nav, please.
And good afternoon. From the very beginning, our government has refocused existing programs to mobilize industry and deploy resources to support Canadian companies as they develop innovative solutions, made in Canada solutions to fight COVID-19. And today, I have good news to share around the work being done to expand the COVID-19 testing. Comme vous pouvez l'imaginer, le Canada a besoin de différents types de tests pour répondre aux divers besoins en fait de volume et de capacité pour diagnostiquer de façon efficace et comprendre la progression du virus. It is essential that testing occur in a variety of settings, including centralized environments, through hospital or testing laboratories, and in more localized point-of-care settings, such as local clinics, long-term care homes, and our more rural and remote communities across the country. A few weeks ago, we launched our point-of-care diagnostic test kit challenge. We asked small and medium-sized businesses to each create a rapid testing kit, comparable to other non-COVID tests that will diagnose individuals affected by COVID-19. And we have now selected 4 companies who will receive funding from the National Research Council of Canada to put their expertise and research and development capabilities towards providing potentially breakthrough solutions for COVID-19 rapid testing kits. Deep Biologics from Guelph, Ontario, Forian from Edmonton, Alberta, Metabolic Insights based in Kelowna, BC, and Nicoya in Kitchener, Ontario. These 4 companies will receive government funding in response to phase 1 of the challenge. These tests, if approved, would diagnose individuals affected by COVID-19 within 3 days of the start of their symptoms using an easy-to-collect patient sample rather than that uncomfortable nasal swab. Instead, these companies have found a way to detect the presence of the COVID-19 virus in saliva, which is a less invasive method than the nasal swab or the taking of a blood sample. As part of phase 1, and within 3 months, the 4 selected companies will bring their expertise and research and development capabilities to each prove feasibility of their proposed solution for a rapid single-use testing kit. Les entreprises qui vont avoir du succès à la phase 1 pourraient passer à la phase 2. Dans la phase 2, ces entreprises vont recevoir jusqu'à 2 millions de dollars sur 12 mois pour mettre au point leur solution proposée. And this is a great example of the work we're funding through Innovative Solutions Canada in partnership with the Public Health Agency of Canada and the National Research Council of Canada. Joining these 4 companies, I'm pleased to announce an investment of nearly $5 million, this time through the NGen Supercluster, which will boost our capacity to actually manufacture point-of-care test kits right here in Canada. Precision Biomonitoring from Guelph is partnering with Ottawa's EVIC Diagnostics to establish a manufacturing facility here in Ontario. Ces nouvelles installations permettront à Precision Biomonitoring d'offrir ses capacités de fabrication à d'autres entreprises de biotechnologie canadiennes. And as we said from the start, collaboration is our best strategy to help Canada emerge from the pandemic as strong as possible. And on that note, I want to thank the members of the new Industry Strategy Council who will join our chair, Monique Leroux, to share their perspective on the challenges being faced across our industries. Over the coming weeks, the Council will serve as a forum to hear from and collaborate with well-respected industry leaders to assess the scope and depth of the COVID-19's impact on industries and identify the specific sectoral pressures. I have every confidence that we will continue to deliver as we work together with Canadian business community to meet the demands now and into the future. Thank you very much. Merci beaucoup.
Okay, thank you very much, Nav. Et maintenant, je donne la parole au notre président du Conseil du Trésor, Jean-Yves Jean-Yves, s'il vous plaît.
Merci, Christia, et bonjour tout le monde. Le message du Premier ministre ce matin portait sur l'importance d'être des leaders et des alliés. Premièrement, dans le contexte de la lutte contre le racisme et le racisme systémique partout au Canada. Comme élus, les Canadiens s'attendent à ce que nous soyons des leaders et des alliés. Mais comme citoyens, nous avons aussi une responsabilité à être des leaders et des alliés pour s'assurer que tous et toutes puissent vivre dans la dignité et dans la sécurité partout au pays. Mais des leaders et des alliés aussi dans la lutte pour retourner vers une relance économique solide. Le ministre Baines annonçait il y a quelques instants la formation du Conseil sur la stratégie industrielle dirigé par Mme Monique Leroux, est composé de 9 membres connus et reconnus au Canada qui vont travailler à la fois comme leaders et alliés pour nous permettre de passer à travers les importantes perturbations à la fois conjoncturelles et structurelles que nous vivons depuis plusieurs semaines. Alors nous leur sommes déjà reconnaissants de ce travail pour appuyer le gouvernement canadien à passer rapidement et fortement à travers la crise économique. Merci, Christophe.
OK. Merci beaucoup, Jean-Yves. Et on est prêt à répondre à vos questions. Carl, s'il vous plaît.
Merci, Madame la Vice-Première ministre. So, as usual, we'll start with the questions on the phone before we turn to the room. Operator, over to you.
The question is from Lee Bertium with Canadian Press. Please go ahead.
Yes, hi. This question is for Minister Freeland. Given that you've made protecting journalists a foreign policy priority, including in a joint effort with Britain, what do you think about the violence that has been directed at American journalists right now? And how responsible is President Donald Trump for his anti-media rhetoric, calling journalists enemy of the people, for inflaming that?
Thanks for the question, Lee. And it's something that I have been thinking about a lot. Journalists are not the enemies of the people. Journalists serve the people. Speaking from my own experience in government, I cannot say that every single question that I am asked by a journalist is welcome or easy to answer. But I am absolutely convinced that the fact that journalists are present to bear witness, the fact that journalists are present to hold governments to account, makes governments better. So freedom of the press is an essential human right, and it is an essential element in making democracy strong.
En français, s'il vous plaît, Madame la Vice-Première ministre.
C'est une très bonne question. Et en tant que journaliste et en tant que politicienne aujourd'hui, j'ai pensé beaucoup sur cet enjeu. Et je dois dire que, en tant que politicienne, je ne peux pas avouer que j'accueille chaleureusement chaque question que je reçois. Il y a des questions difficiles, évidemment, mais je peux dire aussi que je suis plus convaincue aujourd'hui que jamais qu'avoir des journalistes forts, avoir une presse ouverte est un élément essentiel de la démocratie. À cause des journalistes qui sont présents pour voir ce qui se passe, qui sont présents et ont le pouvoir de poser les questions au gouvernement, les démocraties, absolument incluant la nôtre, sont plus forts. Les journalistes et le journalisme est essentiel pour la démocratie. Merci.
Lee, follow-up.
And this question is for Minister Anand. The government has ordered close to 40,000 ventilators, but only 203 have arrived, a number that's remained largely the same for weeks now. Is there a problem? And in terms of KN95 masks, millions have been redirected outside the healthcare system. Where exactly are they being redirected, and are you allowing the resale of them to the public?
Thank you so much for those two questions. The first question relating to ventilators is a good one. You're right, we have received just over 200 ventilators. The contracts that we have in place for a large portion of the remainder are in place with Canadian manufacturers, as both Minister Baines and I have discussed at these pressers in the past, and they will be arriving over the next months as these companies, some of which are retooling, some of which are starting up to do the ventilator production, are doing just that. And so you will see the numbers of ventilators on our chart on our website increasing over the next months. I will say that those ventilator procurements are in addition to the existing stock of ventilators that the Public Health Agency of Canada has. And of course, provinces and individual healthcare systems are making their own procurements across a range of PPE and other items as well. Moving on to KN95 masks, close to 2 billion masks have been redeployed to other areas of government. At this point, there is no plan to make those available for retail use. I want to remind you and everyone that we are still in the middle of the crisis, especially from a procurement perspective. And all of our procurements at the current time are based on federal and provincial orders that have come into us for delivery out to the healthcare system. There is a demand for PPE outside of the healthcare system, and we are currently devising a means by which we can be more broad-based in terms of supplies and use of PPE across Canada. Thank you so much.
Thank you, Minister. Operator, next question, please.
Merci. Our next question, notre prochaine question, c'est from Manon Cornelier avec Le Devoir. Please go ahead, à vous la parole.
Oui, bonjour. Mr. Baines, cette question est pour vous. Vous avez annoncé la composition de votre conseil sur la stratégie industrielle. Et il n'y a que, donc pour parler à l'avenir, un instant, excusez-moi. Et bon, donc sur le conseil sur la stratégie industrielle, et c'est pour vous informer sur l'avenir. Il n'y a aucun représentant des travailleurs. Ils ne font pas partie de la stratégie industrielle. Ces gens-là, ils font juste en subir la mise en œuvre. Allô?
Elle est en train de répondre.
Oui,
Okay. Nav, go for it. Mute
merci
yourself.
pour votre question. Le conseil représente toutes les industries partout au Canada. Et notre objectif est très clair. Nous devons avoir une stratégie qui peut aider et améliorer la situation pour les travailleurs. Ce n'est pas seulement le secteur, mais c'est pour les travailleurs. So, notre stratégie représente les opportunités d'avoir une bonne conversation avec les travailleurs aussi. C'est pourquoi nous avons engagé le chef pour chaque industrie qui peut proposer les solutions pour les travailleurs.
Oui, mais les travailleurs, eux, vous ne voulez pas les entendre? Il n'y a aucun syndicat, aucun groupe de travailleurs représenté sur votre conseil.
Encore une fois, écoutez, le conseil représente l'industrie, représente le secteur privé. Et le secteur privé crée bonne atmosphère pour les travailleurs. Nous allons engager les travailleurs, les syndicats partout au Canada. Absolument, je vais travailler avec mes collègues dans les cabinets aussi, et nous allons engager les syndicats partout au Canada.
Merci, Monsieur le Ministre. Opérateur, prochaine question, s'il vous plaît.
Thank you. Merci. Our next question, notre prochaine question, is from Alex Bellington with the Toronto Star. Please go ahead. À vous la parole.
Hi, thanks so much for taking my question. Just on the syringe order, when will these syringes start arriving? And just the second part of that for Dr. Tam, if I can, do you think that in order for a vaccine to be effective, that it needs to be mandatory that, we have 37 million syringes coming in that basically all of Canada must be vaccinated when this arrives?
Thank you so much, Alex, for that question. The contract with Becton Dickinson for the syringes is a new contract, and the delivery schedule is still being determined. But I will say that we are planning ahead for the eventual discovery of a vaccine. So the need for those syringes at this very moment is not as high as we are seeing across other PPE items. Having said that, we are working to procure supplies, including those syringes and other supplies that would be needed for the eventual discovery of a vaccine and its administration throughout Canada. But for the health aspect of that, I'll turn it over to Dr. Tam, who may have more to say on vaccine administration.
Yeah, so I think we don't know if we'll have an effective vaccine, but we need to plan ahead for that eventuality. So we have a committee, the National Advisory Committee on Immunization, that'll be looking at the sort of framework for prioritizing the provision of vaccine to Canadians. And there's no requirement or mandatory policy from the perspective of the federal government. It is not something that we've, provided even in, for example, the last pandemic of 2009. We do account for the maximum number of Canadians who may wish to be vaccinated.
Alex, follow up?
Yeah, just moving to the I guess this is for Minister Bain, the rapid testing kits. Obviously, there was a hope of getting some from that Ottawa company, Spartan, I think, recently that kind of fell through. When will we see, or when can we expect to see rapid testing kits actually in use in Canada with these new research agreements and all this?
Well, thank you very much for your question. When it comes to testing, we know that it's important for the restart of the economy to ramp up our testing. We've looked at Made in Canada solutions for making sure that we have sufficient reagent and swabs for lab testing. We've also put forward solutions for serology and test kits for that. What I announced today are low-cost point-of-care diagnostic test kits. And these are going to be used for clinics, airports, particularly for rural and remote communities. And the objective is to get quick, rapid test results. But this is early stages. This is a prototype with a proof of concept that's going to be developed. It still needs to be approved by Health Canada. So this is a bit of a long-term play. This is not something that's going to be up and running in the next few weeks. It'll take months. But the idea is to complement the other testing initiatives as well, and really to mobilize our innovative, skilled innovators across the country who are highly skilled at coming up with different solutions. And this is a byproduct of a challenge that we put out to industry to come up with new solutions. And you looked at saliva sample-based solutions, which are easier to administer, but we need to go through the appropriate due diligence, particularly with Health Canada, in order to make sure that we have the appropriate setup in place for clinics, for airports, for rural and remote communities. But this is a bit of a longer-term play.
Thank you, Minister. We'll now turn to the room. Mackenzie.
Hi, Minister Freeland. Mackenzie Gray with CTV News. The Prime Minister has mentioned, and Minister Duclos even mentioned in his remarks, that we should be better allies for Black Canadians. I think that many Black Canadians and many activists would agree that being a good ally means calling out people for what they perceive to be injustice. Why has the government not been more forceful in its reprimand of President Trump's approach to how the protests have gone, and in particular calling in the army to potentially deal with protesters?
Thank you for that question. It's a really important one. And I'd like to start by being very clear that racism exists here in Canada. As we heard Jean-Yves say a moment ago, systemic discrimination is real. Anti-Black racism is real and unconscious bias is real. As a Canadian politician, as a Canadian leader, my focus is on Canada, and it is on being very clear within our government and with Canadians that this is not a problem to which we are immune. It is a problem here in Canada, and it is our job today to listen to Canadians, to listen to Black Canadians, and it's time for us to act.
I must note, though, in the answers that, and the questions previous and the answers the Prime Minister gave, and then the response you gave here, you haven't mentioned President Trump by name. Are you concerned about blowback from the U.S. if we are to get involved in an issue like this?
What I am concerned about, actually, is Canadian complacency. I think that it's really, really important for us to set our own house in order and for us to really be aware of the pain that anti-Black racism causes here in our own country, of the reality that we do have systemic discrimination here in Canada. And I think that we as Canadians, all of us, need to take this very traumatic moment for many people in the world as an opportunity to look at what we are doing in Canada and to work hard to do better.
Merci, Madame la Vice-Première ministre. Opérateur, une dernière question au téléphone, s'il vous plaît.
Thank you. Merci. Our next question, la dernière question, is from Mélanie Marquet avec La Presse. Please go ahead. À vous la parole.
Merci beaucoup. Bonjour à tous. Ma question est pour Madame Freeland. Toujours concernant les États-Unis, avez-vous échangé au cours des derniers jours avec un homologue américain, donc je ne sais pas, peut-être M. Pompeo, pour dire en fait les préoccupations du Canada par rapport à ce qui se passe au sud de la frontière?
J'ai échangé avec un homologue américain dans les journées passées, mais on a échangé sur les concerns autour du commerce international et notre accord de libre-échange. C'était un échange très spécifique. We're in constant touch with our American partners. I very specifically have had some communication with American counterparts very specifically about trade issues.
Mélanie, en suivi?
Oui, et puis, oui, s'il vous plaît. Madame Freeland, en suivi sur un autre dossier complètement, j'aimerais savoir où en est le dossier de l'opération militaire, l'opération laser dans les CHSLD du Québec. Est-ce qu'un accord a été conclu entre le gouvernement fédéral et la province de Québec?
On est en train, c'est une très importante question. Je voudrais commencer en disant à quelle mesure j'apprécie le travail énorme des hommes et des femmes de Forces armées canadiennes. Et je suis très fière d'eux. Je pense que tous les Canadiens doivent vraiment être remerciants aux Forces armées canadiennes pour ce qu'ils font. On peut dire que vraiment on parle de sauver les vies des Canadiens. Comme vous savez très bien, on est en train maintenant de discuter avec l'Ontario et le Québec pour combien de temps encore les forces armées vont rester là. Le Premier ministre était très clair que ce n'est pas une solution à long terme et qu'on doit trouver des solutions pour maintenant. Les forces armées ne peuvent pas rester là toujours et on est en train de résoudre, de régler la situation avec les provinces.
Merci, Madame la Vice-Première ministre. On a le temps pour une dernière question. We have time for one additional question, operator.
Thank you. Merci. La prochaine question, next question, is from Catherine Nick avec la presse canadienne. Please go ahead.
Oui, bonjour à vous tous. Ma première question serait pour Madame Anand et peut-être Monsieur Baines. En fait, vous avez émis le souhait que le Canada soit autosuffisant en termes d'équipements individuels. Je me demandais, est-ce que vous considérez que le Canada suit la trajectoire qui était prévue en ce moment-là? Et à quel moment peut-on estimer qu'on n'aura plus besoin d'importer du matériel d'autres pays comme la Chine?
Je voudrais commencer donc dans la parole à le ministre Baines. Nous ne lâchons pas. Bien que des défis subsistent, nous maintenons un flux constant de marchandises provenant de diverses sources domestiques et internationales pour maintenir le chaîne d'approvisionnement. Et nous avons les contrats avec les fournisseurs domestiques et internationaux et nous devons avoir une priorité pour maintenir, pour commander, pour avoir les autres, l'équipement pour les Canadiens et les Canadiennes. Donc, c'est une chose très importante dans le court et le long terme et nous sommes agressifs et proactifs pour les Canadiens et les Canadiennes. Donc aussi, Nav.
Merci, Anita. Je suis d'accord avec ma collègue. Nous allons continuer à fabriquer l'équipement essentiel. Par exemple, maintenant, nous avons 700 entreprises partout au Canada qui ont fabriqué l'équipement essentiel pour tous les Canadiens. Et je suis certain que notre capacité va continuer à augmenter.
Catherine, en suivi?
Oui, ça n'a pas tout à fait répondu à ma question qui était à quel moment pourra-t-on être autosuffisant, mais j'avais aussi une autre question sur les seringues. Je voulais vous entendre en français là-dessus. D'où viennent les seringues et à quand peut-on s'attendre à les recevoir?
Nous assurons que nous avons tous les produits que le Canada a besoin. Et maintenant, les produits comme les syringes viennent dans le court terme. Mais ça, ce n'est pas le produit que nous inquiète. Nous avons besoin de beaucoup de choses avant les syringes, comme les blouses, comme les gants, comme les ventilateurs. Donc, nous concentrons sur ces produits maintenant et aussi les autres produits pour le long terme.
Merci, Madame la Ministre. Ceci met fin à la conférence de presse. That's it for today. Thank you, everyone.